day, ma'am. I am April Pidir, the pharmacist on duty today. How can I be of service?
Hi April, I just came with my appointment from my doctor and she gave me this renewal of my prescription. Can you take a look at it for me?
Sure, ma'am. No problem. Let me take a look at it for a moment. But before that, may I know your name, ma'am?
Oh, I am Rosa Hoods.
Okay, Ma'am Rosa. May I ask if I can have a minute of your time? This will not take a long. I just need to conduct a patient counseling for me to fully review your prescription, ensure that there are no drug-related problems that may occur. This also to make sure that you understand the medication prescribed to you.
That will be fine with me.
Great. So based on your prescription, you have this medication, digoxin. Do you know what this medication is for?
Hmm. Oh, that's digoxin, my heart pill.
How do you take it, ma'am?
I take it once a day in the morning.
What kind of problems are you having with this medication?
None. What kind of problem could this medicine cause?
That's good to hear, ma'am. How about this medication? Catopil. What is this for, ma'am?
Heart pill.
How do you take it, ma'am?
Oh, the captopril. I take it 2 to 3 times a day.
So, what kind of problems are you having with this medication?
None. What kind of problems could this medicine cause?
Well, ma'am, Catopil works to lower your blood pressure, which can make you feel dizzy and lightheaded. Other common side effects include dry cough, skin rash, and a change in the way a food tastes. Do you recognize any of these side effects? Have you experienced them upon taking this medication?
Actually, yes. After taking this medication, I actually felt really dizzy. If I can remember it correctly, it started about 24 hours after taking this medication, after taking it. It was really bad enough talaga that I saw spots and I almost fell. It happened primarily when I got up out of bed or from a chair.
Noted, ma'am. May I know what you did next after such an encounter?
I tried getting up slowly and it only helped some time. So I stopped it for a day and it went away. Then I start back at one pill twice a day for a couple of weeks. I'm back up to one pill 3 times a day and I am not having any problems. I'm going to try to slowly increase it to what the doctor wants me to take. I meant to ask him about it, but I forgot.
Okay, noted, ma'am. By the way, I meant to ask you, are there any other medication that you are currently taking aside from the ones you mentioned?
Yes. I've been taking aspirin 81 milligram daily to prevent infection.
I see. Can you describe how are you feeling today, ma'am? Are you experiencing any unusual things that might be caused by your medication?
Well, wala naman akong nararamdaman na kung ano man except this new medication. No? It seems to be really working better than the others. I got to have more energy. Then, yun. Nakakapaglakad-lakad na rin ako ng malayo without getting dizzy or, yun, hilo. Ganun.
Glad to hear that, ma'am. Can you excuse me for a second? I just need to call your physician to discuss some matters regarding your prescriptions.
Oh, thank you. I appreciate that.
Hello, this is Dr. Ames speaking. How may I help you?
Good day, Dr. Amos. This is April Pidir from TBP Pharmacy. I'm calling for a patient named Rosa Hush. I want to clarify some things regarding her medication. Is it okay to ask for your time?
Sure, Miss Peder. Could you tell me what the patient's problem seems to be?
The patient sought assistance from our pharmacy after receiving a consultation from you today, and based on our discussion, she experiences dizziness, saw several spots, and almost fell the first time she took the drug prescribed to her, which is catopil. When I checked, I discovered that the drug she was taking had a drug interaction.
Oh, I see. That could really be a serious problem if not addressed properly. May I know what drugs had an interaction?
But upon checking with her, I discovered that she has been taking aspirin to prevent reinfarction. In the case of captopril and aspirin, a serious drug interaction can occur. Since aspirins can reduce captopril antihypertensive impact, while taking aspirin and digoxins concomitantly can increase serum potassium levels, which can result in hyperkalemia, so it must also be monitored. Also, taking captopril can increase the serum concentration of digoxin, so it must also be monitored closely.
So, regarding that matter, I would just prescribe an alternative drug for the aspirin so it would not interact with captopril and also digoxin. Instead of aspirin, give her clopidogrel 75 milligrams to be taken once daily for prevention of reinfarction. So, what can you suggest for the captopril and digoxin interaction?
Since digoxin is already given on its lowest available dose, Doc, I would suggest reducing a frequency of taking it. Instead, she can take it once daily for 5 days and twice daily for the remaining 2 days.
Okay, so it should only be taken twice every Wednesday and Saturday.
This is noted, Doc. Another concern is that the patient adjusted the drug regimen by stopping for a day and then started again by taking one pill twice a day for weeks. Then she gradually increased the pills into two taken 3 times a day without prior consultation with you or a pharmacist.
Well, thank you for notifying me about this early on. We should remind her that it could result in an inadequate dose, making her medication ineffective and may also cause adverse effects.
Yes, Doc, that would be included in the patient counseling.
Thank you for these clarifications and recommendations as well.
Thank you also, Doc Amos. Have a great day. Hello, ma'am. My apologies for keeping you waiting. I have just talked to your physician, Dr. Amos, and I have discussed with her the medication related problems that I have identified. Upon seeing her prescription during our interview session a while ago, we have agreed upon giving you an alternative medication to prevent reinfection, thereby erasing aspirin from your drug therapy as I identified that it has a drug interaction with the other medication you are taking, Catopil, which can lead to toxicities. As an alternative for aspirin, you have to take clopidogrel 75 milligrams once daily, preferably before breakfast for prevention of reinfection. There are no changes in taking catoplir 25 milligrams. Take 2 tablets 3 times a day, preferably 1 to 2 hours after meals. But ma'am, I have to remind you that you have to take it as instructed by your physician. If you experience unwanted effects, you should consult him immediately so he can adjust it for you. You should also not adjust it by yourself so we can prevent adverse effects and also to maximize its therapeutic effects, okay, ma'am? Now, for digoxin, you have to take it once daily, every Monday, Tuesday, Thursday, Friday, and Sunday. While you have to take it twice daily every Wednesday and Saturday. If you are going to take it once daily, it is favorable to take it before breakfast. While if you are going to take it twice daily, you can take it second dose after 12 hours so that it can be before dinner. Are we clear on that, ma'am? Do you have any other question?
That was clear already. Thank you for informing me.
You're welcome, ma'am. May I ask you to repeat some instruction that I have told you with regards to your medication?
Okay, so this digoxin, I have to take this twice daily on Wednesday and Saturdays, right? And once daily naman sa other days. And for my captopril, this one, right? I still have to take 2 tabs 3 times a day, 1 to 2 hours after my meals. And for my clopidogrel, this one, I need to take this 1 tab before breakfast.
Thank you, ma'am. I will also provide you a written information on the things you have to remember. If you still have any questions, you can contact me on the telephone number that is written on the sheet. I hope to you to get best results for your treatment.
Thank you so much, April.
Have a nice day, ma'am.